Good morning. I'm Amy Smollers, Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insight Series session. We are thrilled to be continuing this series, which has hosted nearly a dozen interviews with healthcare leaders on the most important topics facing our Commonwealth patients and caregivers. A few logistics before we start. We will be recording the session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please place them into the chat feature, and we will do our best to get to them with our time together today. Following the webinar, we'll be sending out a brief survey along with the webinar recording. I want to take a moment to thank MHA's 2024 annual sponsors, as well as our strategic partners, for their supporting all of our education programs. In particular, I'd like to thank today's program sponsor, Robinson & Cole. Robinson & Cole is a full-service AM Law 200 firm with a vibrant healthcare practice, serving healthcare clients throughout Massachusetts as well as nationally. They are experienced lawyers trained to help clients meet their business objectives within complicated legal and regulatory frameworks. They're a valued partner in fulfilling our mission at MHA. I will now hand it over to Kate Healy, partner at Robinson & Cole, to say a few words. Just checking if your audio to say a few words, and you can hand it over to Steve for this morning.
Amy, I can hear you. Can you hear me?
Yes.
I'm not on mute, and I'm also, I have my video playing, but I don't see that I am visible. Oh, great. Thank you, Amy, and thank you to the MHA. We are especially excited this morning to talk to Steve Walsh, a terrific and veteran leader at the MHA, as well as Dr. Agrawal, and hear about how one hospital system has navigated the turbulence of the Steward bankruptcy and its vision for community healthcare in Massachusetts. With that, I'll turn it over to Steve Walsh. Steve?
Thank you, Amy, and thank you, Kate, and thanks again for your partnership and sponsorship and all you do for our healthcare providers and the patients they serve in our communities. And thanks to everyone really for taking some time out of your Thursday morning to join us for another edition of our Executive Insights series. For those that have been with us before, you know this is always a unique opportunity to hear directly from some of the leaders who make our Commonwealth's world-class healthcare possible each and every day. We get to hear about their career journeys, their approach to meeting the needs of the workers and communities they serve, and their vision for the future of our system at large. As we meet today, this system finds itself in time of tremendous change. The needs of patients and caregivers are shifting rapidly. Providers are feeling the weight of growing capacity and financial pressures, and the Steward healthcare crisis has reshaped much of the landscape here in Massachusetts. Our guest today has been at the center of this change in just her 10 months on the job. Dr. Abha Agrawal took over as president and CEO of Lawrence General Hospital in January of this year. She is an internal medicine physician by trade, a Fulbright scholar, and has decades of experience in healthcare innovation and clinical leadership. Prior to joining us here in Massachusetts, Dr. Agrawal was the chief medical officer of Humboldt Park Healthcare in Chicago. She is also the founder of A4 Clinics, a globally recognized group of neurorehabilitation centers in India. It has been a true honor to get to know Dr. Agrawal throughout the course of this year, and she has quickly become a critical partner and part of our collaborative work through MHA, particularly around the needs of our communities, hospitals, and the communities that they serve. Dr. Agrawal, thank you so much for being with us today.
My pleasure. Good morning to you, Steve, and to your listeners. I'm deeply honored to be here with you today.
And we have a record turnout this morning. So I think they probably are very interested in the behind the scenes look at Steward Healthcare and the crisis that you have been collaborating with and leading on. But we're going to wait a little while to talk about that because this is really about you. You have a long career in healthcare leadership that spans several continents. Can you take us back to the beginning of your journey? What drew you to medicine? How did your career start out? And then what eventually led you here?
Absolutely. Well, I grew up, let's begin at the beginning. I grew up in a small town in northern rural India, so to speak. I was very interested in becoming a physician from very early on, as long as I recall. One, I liked this idea of helping people, had a great family physician whom we all dearly loved. But also, it was sort of my ticket to freedom from a preordained traditional path in India. I kind of knew that in my heart as well. So after I finished medical school there, I decided I want to go to America because I've heard that's where they have freedom. So I took a flight kind of on my own and arrived at the JFK airport to start my residency at SUNY Downstate in Brooklyn, New York, and immediately felt at home and absolutely happy. As I finished my residency, I started to realize how deeply technology is going to impact both the practice and delivery of healthcare in the future. And that was in 1999, I joined Yale to do a fellowship in clinical informatics as opposed to a traditional clinical fellowship. And that led me to leadership roles in New York City at Health and Hospitals Corporation, and which is a major municipal safety net organization. And from there, I started my career in Chicago, where I was recruited to lead a turnaround and transformation of a hospital on the verge of closure and bankruptcy itself. Um, that was a formative experience for me, which inspired me to move to Lawrence General Hospital in my current role in the Commonwealth.
So you find yourself here, you're in the midst of a crisis. What were your initial impressions of Lawrence General and the Massachusetts healthcare system in general?
So I joined here on January 2nd of this year, and more about Steward in a few minutes. What excited me about coming to Lawrence General was a couple of things. One, it's 150 years of really glorious history of having weathered many storms, right? Including most recently the COVID pandemic, the gas explosions, and all of that. At the same time, for the last, at least 5 years, it was facing significant challenges, not unique to Lawrence General, but safety net in general. Workforce challenges, financial pressures, reimbursement rate, inequities, so on and so forth. But I felt in the middle of all of that, it was providing tremendous quality with a tremendous purpose and mission to the community it serves, the gateway community of Lawrence. And also it had a very good focus on health equity, diversity, inclusivity, and belonging, and it really was manifesting that mission in a true manner. So I was excited to join this team and see if we could start to bring a level of quality and financial resilience and stability for Lawrence General Hospital. But of course, soon after I arrived, we started to learn of the challenges in the Merrimack Valley with the Steward and Holy Family hospitals. So the last few months have been focused on trying to address those challenges.
Yeah, at a bigger level, at the macro level, before the Steward, can you just talk a little bit about some of the unique challenges that independent community hospitals are facing right now?
So I think independent hospitals more so because they do not always have the scale and stability, but healthcare system in general. Number one, I would say, even though things have gotten better, remains workforce shortage, both for physicians, for nurses, and that provides tremendous pressure on access to care. Simply being able to access primary care has become extremely difficult. Access to behavioral health care is difficult. Access to specialty care is difficult. So how do you create stable systems of scale where you do not have enough workforce to address this? And from what I understand, and Steve, you had provided a great presentation to our board about how these workforce challenges are not going to be solved unless we take innovative approaches to solving them. So that remains, a number one issue on many people's mind. I think the second challenge is for especially organizations that are safety net serving disproportionately Medicaid, Medicare organization is the financial pressures, at least partly driven by disparities in the reimbursement rates and partly driven by everything else that we do. So the opportunity, though, is what can we do in terms of innovations on the payment side, the payment model, how we get paid for care, and technology-enabled transformation. So there are tremendous challenges, but I think out of these challenges, these crises, will come opportunities that we may not have seen before. So overall, excited about it. My impression of Mass Health, you asked me this question. It so happened that I attended the Mass Hospital Association's leadership meeting toward the end of January, soon after I arrived. A few things that struck me being in that meeting and even before that, as I was looking to move here, the enormous focus on this 1115 waiver, which it has on health equity and aligned financial and other incentives for hospitals to achieve health equity in a meaningful fashion. I think the Commonwealth has done more in that regard than what I might have experienced in my previous role. So that was very attractive, and it's real. It wasn't simply talking about health equity. We were walking the talk, and that, I think, was a very immediate early impression to me of the healthcare in Commonwealth. Lawrence General has done a great job. I mean, we became on September 17th the first standalone hospital in Massachusetts to get a Joint Commission Health Equity certification, and one of only 12 in the country. So, I think, and it's because, the Mass Hospital Association, the administration of Governor Healy has created that momentum toward equity. And secondly, I think I was a newbie here, only been here just a few weeks, and received a very warm welcome both from you, Mass Hospital, and many other CEOs in the Commonwealth. So I'm glad to be here.
Well, we're thrilled to have you, and thanks for the comments on the waiver. Certainly, we believe it. And first state in the country to have all our hospitals now accredited by the Joint Commission, which I think is real progress in an area that we haven't done as well as we should have over the years. Just talk about Lawrence for a minute. I mean, I'm not sure if folks, if they don't know Lawrence or haven't visited, just for size and scope, what's your number of ED visits?
Yeah, so Lawrence is sort of an acute care, emergency care, primary specialty care, maternity. We are a level 3 trauma center. We do about 65,000 ER visits a year. There is a med flight program, so if we have more complex trauma cases, we can fly them to Boston. I think the two things that I want to share with your audience about it. One, when it comes to emergency care and acute care, Lawrence is very well recognized in the Merrimack Valley. I meet with people from all over, from Andover to North Andover to Methuen to Haverhill, and of course, Lawrence. If you're having a heart attack, if you have an acute emergency, people come to Lawrence and know they will get great care. And the most emails or letters I receive from patients, random patients with their experience or their friends, are about very compassionate and high quality care that they received at Lawrence. So that's really a great thing I'd say about Lawrence General Hospital.
Yeah, and certainly the largest employer goes without saying, right? I mean,
Absolutely.
This is not a small community facility when you think about the magnitude and the meaning to the region. Now you add in the system, and let's move to that for a second. Now that's over 100,000 emergency department visits a year when you look at that region. That is a necessary hospital and caregiver for the Merrimack Valley, you certainly recognize that. So when you looked at what was happening in the Steward crisis, we were certainly thrilled to see a local trusted partner like you take over and get involved in that discussion and take over the Holy Family campuses. But can you talk to us a little bit about internally? I mean, it had to be scary. I mean, it had to be a hard conversation with your board. What did that process look like, and how did you walk down that path to get where you are today?
So let me share with you sort of, up close and personal. I come here in January, a couple of days after. I didn't know about Steward Healthcare or Holy Family Hospitals for that matter, for sure. Of course, as a new CEO, you are not only inward looking, evaluating, assessing what your strengths and weaknesses are, but also trying to understand your healthcare landscape, competitive landscape around you. Very quickly, within a few days, it became, the news about Steward started to escalate. And I'm like, okay, how does it impact us? And I quickly learned there are two campuses in our neighborhood. Methuen campus, Holy Family Hospital Methuen campus is 1.6 miles away from us. And Holy Family Haverhill is about 6.8 miles from us. So it was our backyard, absolutely. And we started to learn of supplies issues, basic facilities and equipment maintenance, disruption in clinical care, imminent, disruption, closure of facilities, bankruptcy, rumors, etc., etc. Here is what was very clear to us. What we could not stand by and say it's not our problem, it's a Steward, whatever happens there. Number one, any abrupt closure would have had tremendous impact on us, right? So like you mentioned, we do 65,000 visits a year. Between those two campuses, about 45,000 visits a year at Methuen and 20,000 visits a year at Holy Family, Haverhill. So about the same number of ER visits. No campus has the physical capacity or workforce capacity to absorb all of it. So another example would be we do about 1,500 deliveries a year. Holy Family Methuen does about 1,200. It has gone down this year, but about 1,200 deliveries a year. Nobody could absorb the number of deliveries. So a catastrophic impact on maternity care could happen if Holy Family were to close. Behavioral health. Lawrence General has no acute behavioral health beds. Methuen has behavioral health. Haverhill has behavioral health as well as geri psych beds. We know it's a statewide issue, getting better, but ER, boarding of behavioral health patients, access to acute behavioral health, and that alone would have had, again, catastrophic impact on people around the Commonwealth. So it was very clear to me that closure of these hospitals would be disastrous for patients and organizations. Then the second option we've heard was maybe it could be some other organization that could come here. It could be another for-profit or private equity, someone from outside, or even someone from not local. And we felt that would disrupt care, that has the challenge of maybe care being driven more outside of the valley. And we know healthcare is sort of a hyper-local business. People need access to care locally and conveniently. So then came up this almost audacious and improbable idea, why not create a regional healthcare system that is based on the mission of providing high quality, high touch, equity focused, culturally competent care that is rooted in the community for the community. And it honestly was, maybe I had the benefit of being new and not be bogged down by too much history. So I had tremendous enthusiasm. I absolutely applaud our board for supporting that vision and almost driving that vision. And I would absolutely support the administration of Governor Maura Healey, Lieutenant Governor Kim Driscoll, and Secretary Walsh. Without their support, and many, many other people in the state delegation and the Senate and the House of Representatives, they applauded, they supported, and they carried us through this vision. The result that we are seeing today, Lawrence General taking over Holy Family. It was to a lot of people who believed in this idea of community-based regional system And that's the reason we are here today.
Yeah, I mean, look, the Steward problem is unique in the sense of some of the ways that it was managed and mismanaged, and some of the challenges that we will continue to read about in the legal system. But it doesn't change the underlying challenge for community health and community medicine, particularly in Black and brown communities. I mean, can you talk about where do you go from here? What's the path forward look like? Because I know you and your board know it's not going to be easy.
It definitely wouldn't be easy. And we knew that there are some problems that we know. We knew very well of let me step back. I think the foundational sin, if you will, was this, taking resources away from these facilities. And I can speak firsthand about the 2 campuses of Holy Family Hospital, and using those resources for personal profit and dilapidating, absolutely depleting these facilities of any resources. I make rounds. I love to make rounds on clinical floors. I'm a physician. My soul resides on the clinical floors, right? And I see how dedicated the staff are, but how poorly maintained from an equipment perspective. From the perspective, I mean, we just learned an MRI machine isn't working because they did not replace the helium, and we just spent, I will, a little on the lighter side. I see a request for $56,000 of helium. I said, that's a lot of balloons. Who's having the party, right? Then I realized this is for MRI. And, it's not, and the MRI is working now for the patients. So that challenge is going to be number one. How do we make these facilities safe and optimally equipped for clinical care? I think going back to your question about the foundational problems of underserved communities that serve minority population um, is going to remain. The way I look at it and is that number one, we want to make sure that from all sides there is fair reimbursement and fair investment by way of payment in these communities. And it should be considered an investment and not a handout. And then on our side, as operators in these communities, we should consider this a privilege and not an entitlement, and therefore, have the best possible systems, the most efficient systems, the most fiscal discipline to be able to run these hospitals. So I'm very, very optimistic, though, about this future system. It's going to be a long road ahead. It's going to be a tremendous amount of work, but I'm driven by this vision of creating a system of scale and stability for the next generation to come. And I also keep another sort of vision always in my mind. If not this, how disastrous the alternatives could have been for this community. So on the one hand, it's a great positive vision, but it's also something that was just needed.
Yeah, so I'm going to just stick on this making rounds discussion for a minute. And I'm going to talk about that relative to your leadership style. You make rounds, but not just in the hospital. I mean, in your short time, you're making rounds. You've been tremendously visible in the community around the Commonwealth with members of the delegation, with your posting, your talking. I mean, you're out there. I mean, you're working harder in the community than maybe some of my former colleagues in the legislature. You're running a campaign. It's a campaign for Lawrence General Hospital. I mean, can you just talk about why that leadership style of kind of showing up and being accessible to people is important to you and what it means to the people in your community?
Yeah. I think you make a great observation. One is that's my personal style, to be open and accessible, and I believe in ideas and words and the power of ideas and words and sharing of those. So, and hence this forum, I'm sure. I think our first job when we started on this, and you mentioned the word campaign, Lawrence General, and your audience is perhaps many of them are no stranger, was not the most obvious choice for executing something like that. So our first sort of campaign, if you will, was this idea that Lawrence General is capable and is a good choice for the state and everyone around us to support in terms of creating this regional system. We have had our own financial challenges like any other organization, especially safety net. And how do we have a compelling vision to be able to make that? And secondly, I think in the post 10-1 world, when after we have done the takeover, there has been a tremendous breach of trust between a healthcare institution, which is seen as always there for you, for staff, for the community, where staff didn't know I'm going to have a job, I'm going to have supplies, I'm going to have equipment, I'm going to have support of my leaders. And then the community didn't know we are going to have a hospital for next day. Do I want to really deliver there because the hospital might close and I don't know where to go. So my communication is now focused on repairing that breach of trust and building those bridges between communities, staff, and us toward a common goal. And our common goal is very simple: high quality, diverse, inclusive, equitable care for everyone in this community, and having the resources to deliver on that mission.
You know, we usually ask our leaders around what they do outside of the office to kind of for the holistic health of themselves. And I don't know if you've read a book lately. You might be reading a manual on how to fix a broken elevator. Or I've been to a nice place in the Merrimack Valley that you found. But if there's anything you do to unwind a little bit, give our watchers a little bit of advice about how you recharge.
Yeah, couple of things I would say. Number one, I'm a voracious reader. I've been reading throughout this. That's one of my most favorite thing to do when I want to recharge. I am reading about AI books as much as I can get my hands on. I think Yuval Noah has a book, Nexus. That's what I'm reading presently as we speak. I also watch a movie once in a while. I came across this movie on the basis of sex. It's about Ruth Bader Ginsburg and her fight for equality and what she went through as a new mother, as a female lawyer in that time. That I thought was a very inspiring thing. I think I would say though, as much as I like to have distractions to recharge, but in some ways, I believe I find joy in purposeful work itself. So it's not always like I'm doing this, which is a burden, and now let me find something that is more enjoyable. I believe in this idea, and I know sometimes I quote this from a famous Indian poet, is the Nobel laureate, Mr. Tagore. He said, "I slept and dreamt life was joy. I awoke and worked, life was service, and I worked and behold, service was joy." So if you have purposeful service-driven work, I find tremendous joy and gratification in that.
Yeah, I'll just connect that back to our workforce for a minute. I think that's what we have to help them find again. It's been so hard over the last few years, that joy, right? Love what you do, never work a day in your life.
That's
I think it's
exactly.
important, and I appreciate you building that culture. Just our kind of final question we always ask our leaders, because we have a lot of emerging leaders on the call. Any great piece of advice that you've gotten along your career that you'd like to share with others?
I mean, I stand on the shoulders of giants, have mentors or have the mindset. A lot of people ask me, how do I have mentors? I said, are you ready to have a mentor? Then they are all around you. Be humble, have a learner's mindset, and you will find people ready, willing to help you and mentor you all around you if you are an early career leader. And I find mentors still today everywhere that I look.
Well, our time flies by as it always does, and it's probably a coin flip whether it's Steward Healthcare or AI is more terrifying at the moment, but we could do another whole segment on that. But it has been a pleasure. As I told you privately the other day, but I'll share with the audience. I have a good friend whose mother was in your hospital over the weekend and had an extraordinary experience. Said the compassion, the grace, the professionalism, the care was simply of the utmost excellence. And I know that's culture. I mean, that's from the top down. That doesn't happen by accident. So thank you. It has been a pleasure to speak with you for a few minutes this morning and hearing about everything you're doing to lift up Lawrence General and the community. I hope that we see this for years to come. As you know, our entire healthcare sector is there to support you and your team through it all. And to everyone who tuned in, thank you for all of your daily work to improve the lives of patients and healthcare professionals across the Commonwealth. We have a few exciting programs lined up in the coming months, including the MMA MMS Wellbeing Summit, our annual Women's Leader in Healthcare Conference in December, and our big annual meeting at the end of January. You can certainly learn more about these events and all MHA's upcoming programs at our website, mhalink.org. Thank you for spending your morning cup of coffee with us, and we look forward to seeing you back here for our next Executive Insights episodes. Have a great morning. And again, Dr. Agrawal, thank you so much for joining us and sharing a bit about your journey.
My pleasure, Steve. Thank you for your leadership.